come in?
Miss May,
Yes, ma'am.
how are you today?
All right.
Miss May, my name is LaWanda Williams. I'm a student nurse from East Georgia State College, and I'm here to obtain a medical history from you and do a physical examination of you today, okay? But before we begin, I would like to ask you a series of questions, okay?
Okay.
Can you first start off by stating your full name
Lady Lizzie Mack,
and your date of birth?
July 21st, 1960,
Okay, so that makes you,
58.
okay, are you married?
No.
Okay. What is your occupation
CNA,
and your religion?
Baptist.
Okay, what is the reason for today's visit?
Want to check up?
How is your overall health?
It's good.
Any childhood illnesses?
No.
Any accidents or serious injuries in the past?
No.
Any serious chronic illnesses?
No.
Have you ever been hospitalized?
No. I have hysterectomy.
Okay, so only besides the hysterectomy, any other surgeries?
No.
Okay. How many children do you have?
3.
Are they still alive?
Yes.
And all their delivery was okay?
Yes.
Normal? Do you receive the flu and pneumonia vaccine?
Yes.
The flu vaccine, when was the last time you received it?
It was this year.
October?
Mm-hmm.
And the pneumonia vaccine, when was the last time you received that?
It was this year.
October as well?
Yeah, October as well.
Are you allergic to any medications?
No.
Any medical problems?
But I have high blood pressure.
Okay. What medicines are you taking for that?
I take Norvest, which is 10 milligram, and I take Cozar, it's 25 milligram.
Are your parents still alive?
No.
What type of medical problems run in your family for, say, like your mother, your father, your brothers and sisters? What type of medical problems do they have?
They have high blood pressure and diabetes.
Okay. So your mother had high blood pressure? Any other medical problems?
No.
Okay, your father
He had high blood pressure.
and your sister?
She's a diabetic and high blood pressure.
Okay, and your brothers?
Diabetic and high blood pressure.
Any cancer run in the family?
No.
Okay. All right, Miss May. Do you have any problems with your head, like frequent headaches?
No.
Okay. Any seizures in the past?
No.
Have you had a stroke?
No.
Any problems with your neck?
No.
Any problems with your sinuses?
No.
So you don't have any runny nose, frequent colds?
No.
Okay. Any problems with swallowing?
No.
Any have you noticed any sores or lesions to the mouth?
No.
Have you noticed any swelling to your neck? What about your breast? Any swelling or lumps? Any problems with your heart?
No.
Have you ever had a heart attack?
No.
No chest pain recently?
No.
Heart palpitations?
No.
Any problems with your stomach, acid reflux?
No.
Okay, no nausea, vomiting?
No.
Do your bowels move regularly?
Yes.
When was the last time your bowels moved?
Moved today.
Okay. Is your appetite normal?
Yes.
You haven't had any significant weight loss, have you?
No.
Any problems with muscle weakness?
No.
Any problems with your lungs?
No.
No cough, shortness of breath when you walk?
No.
No swelling to your hands or feet?
No.
Are you in a relationship right now?
Yes.
Do you feel safe?
Yes.
Do you have any problems with depression or anxiety?
No.
Do you have any thoughts of harming yourself?
No.
Are you happy with your life?
Yes.
Okay. Do you feel like you have a good support system?
Yes.
Okay. Now, I know you say you didn't have any muscle weakness, but what about any stiffness to your joints or any swelling to your joints?
No.
Okay. All right, Miss May. Right now, I'm just going to check your blood pressure, okay? gonna be a little tight, okay?
Okay.
Okay. 134.86. Okay, we'll check your pulse. Okay, your pulse is 72, which is good. All right, I'm just gonna check your breathing, okay? All right, respirations are 18. Okay, Miss Ma'am, we'll get you to walk over here for me. All right, Miss Ma'am, we'll get you to stand here, and I want to check your vision at this time while we're standing up. All right, I want you to look at this Snelling eye chart, which is 20 feet away, and I want you to call out those letters, starting with the very top.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P.
Okay, great, Miss May. All right, you have 20/20 vision. I'm gonna get you to have a seat there on the bed. Okay, I'm gonna let the bed up just a little bit. Okay, Miss May. All right, I'm gonna do my physical assessment of you right now. All right, I see that your head is normal proportion to the rest of your body. Your shoulders are symmetrical. All right, and your extremities are the same length and size. Okay, right now I'm just gonna check your head, okay, for any nodules. Let me know if you have any pain. Any pain?
No.
Okay. All right, we'll check your lymph nodes. Okay, turn forward, check your deep cervical lymph nodes. Okay, all right. I'm gonna check your trachea, which I see is midline. All right, we'll check your thyroid gland. Does it look swollen? All right, swallow for me. Okay. Swallow again. Okay, Miss Ma'am, we'll check your ears, okay? Alright. Want your ears look the same shape and size. Alright, I'm just gonna check the inside of your ear, okay? Pull up. Okay, I don't see any redness. No earwax build up, no sores or lesions, which is a good thing. Okay. Your nail now looks good. Just a little bit more wax build up on this side. Okay, that's nice. All right, I want to test your hearing, okay? All right, I want you to cover your right ear for me. I'm going to whisper a word into your ear, and I want you to just repeat it back to me, okay?
Sally.
Okay, good.
Ow.
Okay, great. All right, Miss May, I want you to let me know when you stop, when you no longer hear the vibration of this tune fork, okay? Okay, good. All right. So here is good. All right, Miss May, I'm gonna check your eyes right now, okay? Okay, your pupils are round and equal. Your sclera looks good. I don't see any yellowing. No ruptured blood vessels. Okay. You see no cataracts. All right, Miss May, I would like for you to look ahead. Okay. All right, I want you to just follow my finger with your eyes. Okay. All right, great. All right. Well, now move on to your nose. Your nose is midline. Okay. Have you ever had any problems, trauma to your nose?
No.
Okay. I'm gonna check your nose. I don't see any nasal drainage, no redness, no sores or no lesions, no polyps. All right, Miss May, I want to test your smelling, okay? And also to make sure that you can breathe through your nose just fine, okay? I want you to occlude your right ear for me, and I want you to take a deep breathe in. Okay, are you able to breathe out your left ear fine?
Yes.
Okay, occlude the other side. Okay, you able to breathe through that just fine?
Yes.
All right, I want to check your smell. I want you to close your eyes. All right, and I'm just going to put something to your nose, and I want you to tell me what it is, okay? Smell that.
Alcohol.
Okay. What about this side?
Alcohol.
Okay, great. All right, Miss May. All right, I want to check your mouth, okay? I don't see any sores or lesions anywhere, okay? Your lips are moist, not chapped. All right, open mouth for me. All right, your oral membrane looks good. I see you have some dental caps. How often do you go to the dentist?
Every year.
Okay. All right. I want to check the back of your throat, okay? Say ah. All right, and your uvula is midline. Okay. Your tonsils look good. I don't see any white patches or sores. All right. All right, open one more time for me. Stick your tongue out. Okay, great. Your tongue is midline. All right. Say ah one more time. Ah. Good. Okay. Okay, Miss May, I want you to smile for me. Frown. Pout. Okay. Lift your eyebrows. Okay. Squeeze your eyes shut. Okay. All right, just relax. Okay. All right, I'm gonna check your temporal mandible joint. Okay. Open mouth. Good. Again. All right, great. Now clench your teeth shut. Okay, great. All right, Miss May. All right, moving on down. I want to listen to your lungs. Okay. Now, so your respirations are equal and non-labored. That's good. All right, so take some deep breaths for me. For me. Deep breath. Again. All right. All right, Miss May, I'm just gonna stand here and just monitor your breathing. All right, take a deep breath for me. Okay. All right, your muscles are equal. I'm gonna take a listen back here, okay? Deep breath. Great. Okay, Miss May, I'm gonna let you lay back for me. Okay, Miss May. All right, I'm gonna listen to your heart. Okay, but first I would like to check your carotid artery. I did not see any distension of your jugular veins while you were sitting. Turn your head to the side. All right, I'm just gonna check the rest of your pulses. Okay. Okay, all your pulses are good, okay? I'm rating about all of them are 2. Okay, just gonna check here. Okay, let's see if pulsation. We'll listen to your heart. All right, your heart is a regular rate and rhythm. Okay. All right, I'm gonna check your stomach. Okay, you don't see any protrusion. Your umbilicus midline. Okay, I'm just gonna listen. Okay, the vital signs are active. All right, I didn't hear any. Check your. Okay, I don't hear any bruits from your aorta, your aorta, your renal arteries, or your femoral artery, okay, which is good. All right, I'm just gonna palpate. Any pain?
No.
Okay. Any discomfort?
No.
Okay, take a deep breath for me. All right, don't feel any enlargement of your liver. All right. Your abdomen not to panic, which is good. I'm gonna check your femoral artery. Okay. Okay, Miss May. All right, I want to get you to sit up for me. All right, I want to check your muscle strength. Okay, you just go on here. Let's All right, push against me. Okay. All right, so your hands, spread them out, or let me push them together. To your legs. Very good. Okay. All right, push against me. Okay. All right, your motor strength is the same in all the extremities, okay? All right, I'm gonna check your deep tendon reflex. Okay. All right, your deep tendon reflexes are normal. Okay, Miss Mel, get you to stand up for me. All right, I want you to put your arms by your side and close your eyes for me. All right. Okay. All right. You get your sit back on the bed. Okay, good. All right. All right, your Bloomberg's test was negative, okay? All right, Ms. May, this concludes my assessment. Everything looks fine. I will encourage you to make sure you see your eye doctor at least once a year to get your vision checked. Encourage you instead of once a year going to see your dentist, you need to start seeing your dentist at least twice a year, okay? And brush your teeth at least twice a day. Make sure you get first your blood pressure. Make sure you take your blood pressure medicine at the same time every day, and keep a record of your blood pressure readings. Check them in the morning and at night. Okay. As far as your diet, you need to be on like a no fattening foods. Instead of frying your foods, try baking it and limit your salt intake. As far as your water intake, you do need to drink enough water to keep your joints hydrated. As far as your joints, I did not notice any swelling or any crepitus in your joints, but we do need to keep our joints moisturized. So I would encourage you to drink plenty of water, and also exercise, at least exercise 3 days a week for about an hour. Okay. Your weight was 210. Your BMI, I think, was 36, and normal BMI is 18.5 to 29.4. So you are high. And so you walking and eating right will help reduce that weight and decrease your BMI. Okay. Any questions for me?
No.
Okay. All right. Well, thank you, Ms. May.
Well.